Okay. Hi, everyone. Just give a couple of minutes for everybody to join in. Maybe a minute or so. Feel comfortable. You can let me know once you're in, so I can wave out hi to you. All right. Hi, everyone. I am Cheryl Mascarenhas. Today we are in conversation with Dr. Ameya Udyavar, and this is a beautiful session conducted by Mumbai Road Runners. Welcome everyone who's joining the session. Okay, all right. We have a very, very informed and a super talented speaker with us today. A runner, a doctor, someone who knows what they're doing, someone who's there to give us a lot of information, guide us through understanding where we are today in our fitness journey, what we can do, what we should do, what we should not do, and how to go about taking this fitness journey to another level. Let me introduce our speaker today. We have Dr. Ameya Udyavar. He is an MD in medicine, a DM in cardiology, a DNB in cardiology, a fellow in cardiac electrophysiology, and he has studied from Taiwan and Australia. He's a consultant cardiologist with Hinduja Hospital, with Jaslok Hospital, Echen Hospital, and Tunga Hospital at Malad. He specializes in heartbeat and rhythm disorders. Something that we are going to be very excited to know about, because we've already learned so much because we're into the running journey, but it's going to be eye-opening, I am very sure. I would like to welcome Doctor on board. Hi, Doc. You're on mute.
Hi,
Okay,
good evening, everyone, and good evening, Cheryl.
Good evening, Doc. How are you today?
Yeah, thank you for inviting me for this meeting. I was looking forward to it. I think this is the second event which I'm taking part of as the MRR family, from the MRR family.
We are very excited to have you on board. I've already had conversations with you. It's very intriguing to know the kind of facts that you're going to lay in front of us and how we can improve ourselves. Because I think all our journey, what we're trying to achieve is trying to better ourselves. So what better than, hearing it from the best? Do we go ahead? Can we start off our session?
We can go ahead, I think.
For everybody, most of us on board in this session are runners or in some kind of fitness activity, whether it's cycling, swimming, any gymming. So basically, many of us are in this fitness journey together. So let me just ask you to give us a brief about, what is exercise, how does it, not all health, but we'll just talk about heart health today, since you've majored in heart and its health. So let's just talk about exercise and how it is affecting our heart health.
Right. So what we as physicians we observe is that exercise has a lot of benefits on the body, not only for physical health but also for mental health. And if you come to the Indian population or the laymen people, we see that Indians are one of the least, prevalent exercise community in India. Especially in the rural areas, there is no concept of exercise. In the urban areas, you will see at least the educated class, the aware, who is intellectually aware or who is more into internet or online. Those people have an habit of exercising regularly.
Sure.
And exercise, if you say as a therapy, it has enormous benefits. So in fact, if the benefits range from not only short-term benefits but also long-term benefits. So you have exercise, if you classify them as aerobic exercise, So
Yes.
aerobic exercise is something which increases your heart rate. Okay,
Right.
so that is the exercise which is very good for heart. So if you
Mhm.
want your heart health to improve, the exercise which is recommended is a aerobic exercise where your heartbeat goes up. So we want a target of something between 50 to 75% of your maximum heart rate.
Right.
That is what an exercise should achieve. And you should be
Hmm.
able to carry on this exercise for at least a long duration of, say, half an hour.
Hmm.
The other exercise is what is called as resistance exercise or strength training exercise.
Strength training.
Yeah, so that is basically helpful for your muscles and for the bones. So you're building up your muscle mass, you're building, making them stronger, you're making your bones stronger, especially for elderly. If you are more than 55, 60 years, I think strength resistance training should be a part of your exercise schedule because they are going to strengthen your bones, reduce the chance of fractures, especially in post-menopausal women. So strength training, I think if you are elderly, you should have incorporate. These are the two exercises which we recommend. But unfortunately, what we see as doctors in the community, or even as you, even you also must have seen, that a lot of people they exercise, but the exercise is not good enough, or say optimum rate, heart rate is not achieved during those exercises. So there are a lot of people who walk in the gardens, but they walk slow. So it's not a brisk walk, so it's a slow walk. There are a lot of patients who come and tell me, sir, I do yoga for 1 hour. Now, yoga is a good exercise, but if you are going for postures or pranayam or breathing exercises, they are not going to improve aerobic fitness in any form unless you do something like Surya Namaskars at a fast pace. If the fellow is doing a Surya Namaskar, which is a fast paced yogic exercise, naturally the aerobic thing will come in. But then you see a lot of people, they say, sir, I do this pranayam and that kripa breathing, all those things, and do for almost half an hour, 1 minute, 1 hour a day. There are some people who do yoga for 2 hours a day. But when I ask them, do you walk, do you run, they don't. So
So
especially in
basically,
the
we want
elderly,
to incorporate aerobic along with some amount of anaerobic or maybe strength training. So basically, we are looking at a balance of everything, not to do only one kinds. That's where
correct.
I
So your
think we are
aerobic
getting at.
exercise could be anything. You should do
Right,
any exercise which increases your heart rate.
right.
So aerobic exercise could be cycling, could be swimming, jogging, running, brisk walking. It could be gardening. It could be tennis. It could be
As long as
badminton.
your heart rate increases, that's where
Yes,
you want to target.
correct. So
So
anything
since,
which you love is good enough.
right. So since you brought this up, and since we're talking about both kinds of, exercise, whether it's aerobic, whether it's anaerobic, or whether it's, a strength training, let me ask you, do you have a recommended level? So, or a
Yeah.
recommended amount of time one should do an aerobic workout, or one should do how many times in a week? And I'm
So
talking
we
about
have
healthy individuals. Let's not,
right.
classify
Right.
them into categories because that might be difficult to deal with.
Yes. So we as the cardiologists, we follow what is called as a AHA recommendation, which is the American
Okay.
Heart Association, because they have very strong recommendations, which is based on hard evidence. So
Okay.
it's a evidence-based recommendation which is into play here. So those
Right.
recommendations are that every individual should be exercising at least 2.5 to 5 hours of moderate intensity exercise in a week. So
In a
when you
week.
say in a week, 2.5 to 5 hours of moderate intensity exercise. Now, moderate intensity is basically walking, brisk walking,
Okay.
which is less than 4 miles an hour. So
Okay.
slow walking, that is moderate exercise. Or it could be tennis, double player tennis. It could be
Did you say
slow
4
swimming.
miles an hour?
Yeah,
Yeah. Okay.
4 miles an hour. Brisk walking, less than 4 miles, not more than
Right.
4 miles, less than four
Right.
miles. So that is recommendation of 2.5 to 5 hours, moderate exercise,
Okay.
moderate intensity exercise. And then you have vigorous intensity exercise. There the recommendation is at least 75 minutes to 100 minutes a week.
Okay.
So approximately 1.5 hour, not more than that. So 1.5 to
Okay.
2 hours. So 1.5 to 2 hours of vigorous exercise. Now vigorous
Hmm.
intensity exercise is our running. So if you
Right.
say marathoning, jogging, cycling, swimming, or skiing, these are all high intensity exercise or what we call vigorous exercise. So here the recommendation is basically 1.5 to 2 hours maximum
Okay.
for a whole
Okay.
week. So which is definitely a little less. So their recommendation is this: you can either have a mix of moderate exercise and vigorous exercise, mix of them, and at least twice weekly resistance exercise, which is strength training. So at least one day for upper body, one day for lower body, at least twice a week. So these are the recommendations for all individuals. So if you want to maintain a good health, I think every individual should at least exercise for 3 to 5 hours of brisk walking a week. So approximately, if you ask me, it's almost 45 minutes to 1 hour a day. For every individual, 5 to 6 times a week. In which they can incorporate, say, 15 minutes of running or 30 minutes of running or jogging, cycling, swimming. So any of these exercises, which is vigorous.
So basically, we are putting it around an hour a day. You try to put your moderate and vigorous in that hour so that, you can maintain your health to optimum levels. This is where, this is what we are talking at. Okay.
45 minutes to 1 hour.
Sorry, I'm sorry.
No, yeah, 45 minutes to 1 hour.
45 minutes to 1 hour. Right. Okay. So now we understand that exercise has a great effect on our heart health. Can we go a little deeper to understand what exactly is happening when I do in this 45 minutes to 60 minutes when I'm exercising, whether it's moderate or a little vigorous, or I'm sprint training, what is happening to my heart and my heart muscles?
So let us start with the aerobic exercise first. So when you're exercising, you're doing an aerobic exercise. So you are doing something which is fast-paced. So naturally, the muscles need more energy, more oxygen, and more blood supply. And the heart is the organ which is going to supply the blood and oxygen to your muscles because you're doing something fast-paced. So naturally, the heart pumping has to be faster. So your heart rate is going to go up. It has to eject more blood outside into the chamber, into the body. So you what we call is the stroke volume, the amount of blood which is ejected with each contraction. So the stroke volume increases. Now, when the heart rate goes up, when the blood supply for the heart goes up, the heart is pumping more, working more. So the myocardial oxygen demand of the muscle, the heart muscle, that itself is going up. So naturally, the heart is going to require more blood to carry out these functions. So in this process, your circulation is going to be much better. The coronary artery, which supplies the blood to the heart, is going to need more, flow, so that smaller capillaries, small arteries which are closed during rest will open up. So you get the diverse circulation which will develop, the microcirculation which will develop. Not only that, you are improving the lung functions, your lung capacity, or what you call functional capacity, the lung exchange which takes place, the gas exchange which is taking place in the lungs at the microcellular level, which is oxygen going in, carbon dioxide coming out. That is called diffusion, becomes much better. The lung function becomes better. The heart rate goes up. Your blood pressure also goes up. So, of course, during the exercise, your blood pressure is going to go up. But the long-term effect is that once you stop the exercise, your blood pressure will be lower than what a person who is sedentary, who is not exercising. So, long-term is going to reduce the heart rate. Long-term is going to reduce the blood pressure. Not only that, when you're exercising, you are mentally also feeling much better. So mentally, there's endorphins which get released, what is called happy hormones. So you feel good once you achieve a particular pace, you start feeling good about it. You will have lesser blood sugar, lesser cholesterol, because it also has these aerobic exercises. They all have these multiple benefits. So we call them pleiotropic benefits, where the heart rate goes up, the blood pressure comes down, the sugars come down. The sugars, what is called, there's a condition called metabolic syndrome, which we see in obese people, that the sugars are not totally in the diabetic range, but slightly impaired. So by definition, they don't classify. So that improves. So sugar control is better, blood pressure is lower, bones get stronger. So multiple benefits. In fact, you will see lesser chance of cancers, because not only reduction in weight, the what is called is oxidants, or there are some reactive oxidant species which get. So this acts as an antioxidant effect. So amount of cancers is less. So a lot of benefits. So I would say that everybody should be exercising.
Right. So Doc, I'll back this up with a question that I get very, very often. Now, we know that, the exercise is benefiting so many organs. Let's start with just, the lungs and the heart, great capacity in the lungs and circulation. But I also get back a lot of people saying, oh, I'm exercising so I can eat anything. I can smoke as much as I want. I can drink as much as I want because I'm exercising. Do we see a direct correlation between Can I eat anything and everything because I'm exercising, or how do I work around this? Because, I exercise so I can eat. Is that concept okay?
Actually, it is not okay because we have these marathons where you run a marathon and then you end it with a beer and then with a sumptuous meal. So of
We've
course,
been guilty of that. Yeah, we've been all guilty of that.
so it's okay for a day, I think. But then if you have it as a habit, because there are a lot of people who are exercising but they are smokers,
Right.
who are exercising but they do not eat well. So they still think that I can have a sweet every day. I can have higher portions of food or overeat because I'm exercising, and they are not taking care of other risk factors. So there is something called as the life's essential eight. This is again the
Right.
thing formula by from the AHA. So the
Okay.
American Heart Association. So there is one is eat better. You have to eat better. So the diet has
Okay.
to be very balanced. You can have a cheat day almost once a week. There's no problem at all. But the rest of the day, eat better. Then be more active. That is again exercise related. Then control, know your numbers. So know your numbers is know your blood sugar, know your blood pressure, and know your cholesterol. So these three things, which are you may be exercising, you may be doing a very good form of exercise, but then there is still some residual risk. We see some, once in a while we come across a runner, especially young people, who has had a heart attack. So we
Hmm.
asked him why. They work at night, where they were doing a night duty. Their sleep is deprived, so they're deprived of sleep. In the morning, they're very sleepy, though they smoke 3 4 cigarettes. Then they
Hmm.
have say oily food like a batata vada, because they are half of them are young guys who
Right.
have no
On the move.
families. Yeah, so they're on the move. So they have a batata vada. So you will see out of this, especially Malad, if you go near the in-orbit mall, we have these night on-call centers. You will see a lot of young
Hmm.
people. They're smoking in the mornings and eating batata vada and all that. So if you see there's sleep deprivation, there's no proper diet there. So these residual factors are finally going to eventually build up in the
Hmm.
form of having a plaque burden in your coronary arteries. So not only that, quitting tobacco. Tobacco is one of the, especially for young people, tobacco is one strict no go zone, and we see that that is the single most common factor in young people for heart attacks. So if you are doing exercise the whole day and then you still smoke 5 7 cigarettes a day, in no way you are reducing the risk of a heart attack. So
Hmm.
this residual risk is definitely to be reduced. So if you are eating not a balanced diet, so balanced diet is again from the Western point of view, they say 3 to 4 servings of vegetables and 3 to 4 servings of fruits a day. Now there it is, the diet is little different because they have Western diet where they normally have raw things.
Right.
Here in the Indian food, we have a lot of cooked meals. So
Yeah.
cooked meals, we have almost like 70 80% of carbohydrate,
Yeah.
which is again not a very good thing to have. So I think we should cut down on our carbs, at least bring it down to 50% of your total meal, and increase the proteins. So proteins is like pulses, or if you are having non-veg, maybe white meat, fish, egg. So these are like higher proteins. So at least make 25% of your meal as proteins, and the rest can
So
be
we are
fat.
all the time, every meal targeting to eat better, to at the end of the day, to sleep better, to stress less. One of the
Yes,
point that you told was know your numbers. Now let us
yes,
come back to this knowing our numbers.
right,
Why? Because I want to come, we all want to throw light on runners having heart attacks. We've at least after COVID, we've heard so much. So we'll go to
right.
that a little later. Let's come back to knowing our numbers. So you said sugars, you said our pressure, you said our cholesterol. How often do you think one should go check and keep a tab on them? Definitely not every day. So how often do we do? And is the range that is given okay? Is it okay if we go slightly above it? If we are slightly below it, just enlighten us.
Yeah, so the thing is that what we see is young people coming with heart attacks who are running into running. So
Right.
lot of times you will see, somebody was exercising in the gym and suddenly had a collapse and passed away. This has been
Right.
in the news, every few months you see that a young CEO of some big company was working out in the gym and he passed away. We have had doctors in our community, friends in my community, where 2 3 of them have passed during exercise and after exercise. So here there is something more than what is not detected. So
Yeah.
how to detect is know your numbers. So there is three things. One is your cholesterol, blood sugar, and
Hmm.
blood pressure. Now, these
Right.
three things you will not know unless you measure them.
Correct.
So you need to do a test and see what is your blood pressure. So fortunately, runners have a low blood pressure because of the aerobic exercise. So they remain in the range of 120 to 80, or even in fact even lower. And they have a slower heart rate also. In fact, they feel sometimes giddy because of this slow heart rate.
Sure.
So that is one which we see. That's a blood pressure. So you should once in a while, at least once in a month or once in 3-4 months, see that your blood pressure is okay. So you can
Okay.
either buy automatic. Nowadays we have these automatic BP machines which are there. You can buy it for the whole family, because the whole family members can check it, their blood pressure.
Right.
So one is know your blood pressure. So if it's something which is more than 140/90, most of the time you check say 5 days a week, and you find that all four readings are more than 140/90. So that it means definitely there is a strong tendency towards a high blood pressure. Then the
Okay.
second is the sugar. Now,
Hmm.
diabetes is something which runs in the families.
Yeah.
So if your parents are diabetic, if you have a brother, sister, kaka, chacha, mama, somebody who's diabetic, mama, and all those, so it gives a strong tendency that the family
You will
has a higher
probably get.
incidence of diabetes. So naturally, we are likely to more develop diabetes, more chance of having diabetes. So in these conditions, get a sugar checked at least once a year, so that you know
Okay.
that nowadays these diagnostic centers have what is called preventive health checkups.
Yes.
So once a year of sugar testing and once a year of cholesterol testing, I think should be good enough. So here
Is
the
sugar
numbers
testing
wise,
at home also reliable? We've got a lot of machines now because of diabetes, people checking them all the time. So that's also reliable.
very, very reliable. Yeah.
Okay.
So with the sugar, if your fasting is more than 126, by definition you are a diabetic. So
Right.
then you need to eat well, because you know that you will need to cut down on the carbohydrates.
Yeah.
Because whenever you eat a carbohydrate, your sugar going to peak up. So that is one. And for the cholesterol, anything less than 200 is okay. So there is something called as in the cholesterol, you have something called as bad cholesterol, which is
Yeah.
leading to plaque burden in the coronary arteries.
Yeah.
So here the LDL cholesterol, which is called the
Yeah.
low density lipoprotein cholesterol, LDL. So that should be less than 130 or 160. So anything, if you have a family history of high cholesterol, just like diabetes, some people have higher cholesterol in their families. So if you have any cholesterol which is more than 190 LDL cholesterol, that means we are very, very likely to have a heart problem in the young age, like a heart
Correct.
blockage. So in these 30s or 40s. So then unless you do the test, you will not know. Because there have been cases where, in the marathon, somebody has collapsed and they is taken to the hospital. Then their cholesterol levels are done and we find them sky high.
Yeah.
That is, there was already a cholesterol problem in the individual which was not detected earlier because they never tested for it. So these three numbers, the blood pressure, cholesterol, and sugar, I think every individual, not only runners, every individual should be aware. Especially
Sure.
elderly should be more aware that they have a chance of diabetes or blood pressure, cholesterol, because these three can be controlled with medication. You can
So,
reduce the risk.
nowadays everyone's got their smart watches, they've got their gadgets on all the time. Everyone's only checking, and at what what zone of heart rate am I running? Am I working out? I think the world has completely moved to this smartwatch, and it's not. The
Yes.
funny part is, to be very honest, I think they are lesser bothered about what my heart rate was than what was the other runner's heart rate. Because I know I can check everybody's. I know I want to ask them, but are
Yes. Correct. Hello. Can you hear me? I think I lost Cheryl.
sorry.
Hello. Sorry.
Yes, yes,
I
yes.
think we
Yeah.
lost you. Huh?
Are these gadgets any helpful?
In fact, they are helpful for patients, because there we know that they have a problem like blood pressure, and we want them to control their blood pressure. So we want them to monitor them blood pressure. For a diabetic patient, we want him to monitor his sugar. So if you have a sugar problem, we would want you to have a sugar monitoring device at home.
Correct.
Like that. So same way for all patients, yes, monitoring is important. But if you
Sure.
ask me for a healthy individual, I see less of a role, because once in a while is okay. For what happened is during COVID times, everybody was monitoring the heart rate with that
Yes.
small saturation probe and getting
Yes.
worked up. Oh my God, my heart rate is more than 100,
Yes.
120. And because of this, they were stressing out themselves. Doctor, my heart rate is 120. What has happened? And because of fear, again, they used to get more scared and used to go to 130. Doctor, heart rate has gone to 130. So you were
Vicious
unnecessarily,
circle.
yeah, it's the vicious circle which was building up, and it was so prevalent during the COVID times. Even mild fever, you check your heart rate is bound to be high, and they were
Yeah.
getting stressed out because of that. So for a normal individual, healthy individual, I don't think there should be a lot of monitoring required. But then there is no denying the fact that technology today has advanced, and if you ask, you have watches which can monitor from heart rate to saturation to respiratory rate, your sleep patterns, whether it's a deep
To
sleep,
sleep, yeah, to
REM
deep
sleep,
sleep,
NREM
to
sleep.
how much you were moving, to everything. And I think at some time we've become so addicted to it that when we wake up in the morning, we want to know how we slept, how many hours of deep sleep I got, and what is happening. If we forget all this and
Yes,
just go to sleep, I think we'd rather sleep
will be much
better.
better.
Or if we go out to run without actually monitoring, I think we'll do a better job than being overly worried about where am I and what's happening.
Correct. So the advantage with these devices are that for population studies. So for
Right.
example, I can give you an example. In America, with the Apple iWatch, 3
Hmm.
million individuals were observed. It was done by
Okay.
a university hospital, and 3
Okay.
million Apple Watches heart rate was observed. And
Hmm.
there they found that almost 6% of the people had an abnormal heart rate or a rhythm problem,
Wow.
which was
Okay.
called AF, which is a
Okay.
heartbeat problem where the heartbeat becomes irregular. So there you see there is definitely role for technology, because we could
Right.
detect these 6% of people who never knew that they had AF. So if
Correct.
a normal person is not wearing a watch, he would never know that this problem is there. So the biggest
Right.
advantage of technology is that picking up those unknown patients who don't know that they have a problem. So if you see the
Yeah.
technology is going to be so, say, revolutionary, there will be mirrors which will do a retinal scan. So when
Hmm.
you stand in front of the mirror in the morning, there will be a retinal scan which will be done by the mirror, and it will tell you about your cortisol levels, blood sugar levels, and so that is the way the technology is coming in. Like,
Yeah.
and there will be
Yeah.
clothes
Yeah.
which can sense your sweat rates, your blood pressure, your BMI, your basal metabolic rate. So the way the technology is innovating is quite a good thing. But the thing is that you should not be over dependent on the technology, because finally we as individuals, you should feel good about what you do, right? So you when you
So I
run,
think the
you will see
message
lots of
here
runners
is
checking
the
their heart
message
rate.
here is yeah the message is to look at your values, maybe to work on what you can be better yourself, and not to sweat too much about things that everyone's just hyping or talking. So you want to try to find a balance between how much you want to
Yeah,
use that technology in your life and
totally,
how much you want to
totally.
be affected by it, because I
Yes,
think we are all in this peer pressure that like every other runner puts it up as soon as the race is over. Array, what was your timing? What was your timing? So the more I'm reading, I'm
so you,
understanding we are putting speed first, then we are
yes,
putting that distance, and then we are putting the form. So we know
yes,
so many people are into wrong forms and long term effects
yes,
of that.
correct.
And then you come to the general conclusion, Array, running is bad. I was running, mera knees ko aisa hua, vaisa hua. Yeah, that's because everyone's having their own experience. While I think the
Correct.
most important would be form, and then would be distance and speed. So, this technology is making us do those things, not make us do those things. So I think some of us are still in that dilemma whether, we should use that technology for our benefit or no. And as you rightly said, just put it to the right use.
As
It's
runners,
good that we get so much of statistics out of it, for study purposes, but
correct.
nowhere to draw the line, right?
As runners, we are slaves to the Garmin watches.
Oh, yeah.
So you see everybody when he starts the watch, he will skip on looking ki pace kitna hai, and then he will either reduce or increase the pace. Even if he's tired, he will say, "Oh, I'm reducing my pace." He will start to overdo it. So that I feel that is just taking out the joy from the actual running process.
Absolutely.
The whole
Absolutely.
thing about exercise is to have fun and have feel good about it. So
But
means
the other good thing that the other thing that I've always heard is, oh, I did my workout, but I forgot to put on my watch. But I mean, we didn't do it for the watch; we just did it for our health. So I think we've slightly tweaked our definitions about how we are going about with fitness and
in
health.
fact, one of
So
the
well,
easy ways to get rid of the watch is just go and run with your wife. or your son or daughter. Because what happens, then you will be matching their speed, and you will having a good conversation during the run, and at the end of the run you will feel very good because you have had a very
Like
good
we
bond.
take a social detox, we go to
Yes,
the mountains, no network, nothing. Sometimes I think we should just leave our watches and just do it for the fun of it, no record whatsoever. I don't know how many calories I burnt. I just felt good at the end of the day. I think that should take some kind of importance in our level. So while we are on this topic, I want to bring a very important concept.
yeah,
See, when COVID hit us, everyone went indoors and, everything became online. Um, it happened to me. I went through this phase of overdoing my exercise, whether I was teaching. So I was also teaching. I was also practicing. I started increasing the number of classes. So I was at least teaching 5 classes and I was working out all the 5 classes. Plus I was doing my bit of a training, and then how much ever I could walk at home or skip or just, some kind of aerobic activity. And I burnt out. At a phase, I burnt out. It came out differently. It didn't come out as a physical exhaustion for me. It came out as a mental exhaustion. But I did burn out, and then it took me a long while to realize what I did. So I feel there's this very thin line between doing and overdoing. In today's scenario, with runs every Sunday, with people, getting into marathons or 21 kilometers every other Sunday,
right.
where are we heading with this kind of pattern?
Yeah, so overdoing is definitely harmful. I myself experienced it during the COVID time because
Okay,
being a cardiologist, I was doing some COVID duties. So I was assisting in the COVID wards by wearing the PP and all. But then we were
right,
not there all the time. We were there maybe 3,
right.
4 hours a day. As a consultant, we were looking after like 40, 50 patients, and the remaining time was free. So the actual amount, the duration of work had definitely reduced. So I had
Correct.
plenty of time for exercise. So I overran. I did lot of body weight exercise, and
Okay,
I also did weight training exercise, and also
okay,
cycling. And after a few months, there was this course by yoga by Sri Ravi Shankar, online
right,
4-day yoga course. That also I did. Then there was an
okay.
advanced course, and in that I think I sprained my iliotibial band. So after that, I had to go for therapy for getting it, better. And then they told me that don't run for 2, 3 months because it
Oh,
had
wow. Okay.
so there was no tear, but acute inflammation. So
Hmm.
they said that you will have to. So that overdoing definitely harms. There's no doubt about it. In fact, if you go by studies, as we increase the amount of exercise, your benefits are going to be better. So you will have better
Okay.
heart rate, better blood pressure. But then beyond a certain point, there is no benefit. So
Hmm.
if you see all the studies, there are a lot of studies. So exercise more than 9 hours a week
Hmm.
is okay.
Is actually harmful.
Beyond that is no benefit.
Is it
So
harmful?
so if you say marathoners, if you're running
Hmm.
more than 25 kilometers a
Hmm.
week, is
Hmm.
going to be harmful. These
Oh,
are not
wow.
my statistics. These are statistics from the studies done in
Right,
marathoners, runners, and all that. So if you
right.
say 25 to 32 kilometers, so there has been
Okay,
a study where they did in I think South Carolina, where they
okay.
studied runners who were running for years, 15 years, 20 years, and they found that they had a higher chance of heartbeat problems and
Okay.
some other things like which we may discuss in some time. So heartbeat problems was slightly more prevalent, and in fact it was unsafe because they were doing a vigorous activity for hours.
Hmm.
Now, if you do a moderate exercise, which is moderate intensity, it is risk is less, like this walking. But when you're doing a vigorous exercise, which is going to be running, cycling, swimming for hours,
Hmm.
there is going to be some load on the heart because heart is continuously pumping at that rate of 140, 150 for hours, 3 hours, 4 hours, 5 hours. So that
So
is
should I
definitely going to
say
affect. Yeah.
that runners can also get cardiac arrest or heart attacks? Or maybe, first of all, what's the difference between a heart attack and a sudden cardiac arrest? And
Correct.
why does a runner get it? Because we've seen runners. So
Yes.
by running, can I prevent a heart attack, or am I prone to because I'm overdoing it?
Yeah. See, statistics wise, one death per year in 2 lakh athletes is sudden
Okay.
cardiac arrest. Okay, but the same thing if you compare with the footballers who are playing the professional level, okay, and basketball players in America, it comes to around 7 to 15,000. That is one death per year per 15,000 or 17,000 players, athletes. So there is no
Okay.
doubt that there is slight increase because it is going to put a load on the heart. Okay. So when you cross a particular threshold, not only the benefits come down, but your chance of having a cardiac arrhythmia increases. And it's not necessarily cardiac arrest. So it's not only so cardiac arrest basically is where the heart is arrested. Arrested means it's not pumping. So it's a
Right.
heartbeat problem. It's not a heart attack. So we see when you suddenly collapse, that is either because the heart has just stopped pumping. So that is a heartbeat problem, that the heart has just stopped pumping. So it's an electrical
Okay.
problem where the heart just stops pumping and it's called as a cardiac arrest. So when the heart is not pumping, they're just going to pass out at that time. So
Okay.
that is called as a cardiac arrest. So this is the heart attack patient will get some time. They will get chest pain, they will get breathless, and they will feel vomiting or nausea. They will go to the hospital. They will take treatment. They will take a ECG. They will find, oh, ECG shows a heart attack. We'll do angiography or angioplasty, open up the block artery. So the patients do get some time. But with the cardiac arrest, when the heart suddenly stops, there is no circulation to the brain, to the
Correct.
whole body. So in fact, you are only having 4 minutes for preventing brain damage. So a CPR is the one thing which can save the patient, or a DC shock,
Correct.
that is the shock device. So if you say cardiac arrest wise, slightly increase in cardiac event rates when it comes to prolonged exercise, especially when
Okay.
you're not taking care of your good sleep. So sleep is extremely important. Pollution, cold weather. So if you're exercising in a polluted air, which is very cold, so you see it in normally northern, say North American states, Canada and
Right.
so, where you have a cold weather, or UK, where the runners are running in cold weather. Pollution here in India, definitely, because in sometime in December, I remember it was extremely polluted with extremely cold weather. So morning 4 and 5, you could just see fog, nothing else. So if one is going to breathe in that air continuously for hours and hours, definitely it's going to be having some effect.
Correct.
So pollution and cold weather. So these two things. And cardiac arrest wise, patients collapse during marathon is lot of factors are there, because it may be not adequate hydration. They may have a prevailing coronary artery problem which was not detected. That is the commonest cause. When you do angiography, you come to know that they already had a coronary artery disease which was not detected earlier. And when they any patient with a coronary artery blockage, when he's exercising, slightly high chance of having a cardiac issue. Right. So these are the two things which I think, and there are
So
a lot of
between recreational runners, or let's just define an athlete. Let's understand whether we are putting all of us in that category. First of all, are we athletes? Because training patterns become different. Now, what I understand is we look at certain people and they become our idols, and we try
yes,
to achieve that. But maybe we don't understand what's their goal, what's my goal. It could be very different. So
yeah,
maybe I'm blindly following something. So, athlete's heart or a runner's heart, or one who's just running for recreational, is that similar?
yeah. So by definition, if you say we are all athletes, so anybody who is able to perform a vigorous, strenuous activity which is having a demand on the body, and it may be in the form of strength training or aerobic or agility. So any of these ones, if you are doing more than what a normal person does, by definition you are an athlete. Of course, now your load will depend. If whether you are doing a professional athlete who will be doing hours and hours of training, while you are a recreational runner, you will be doing it lesser. So definitely there is a condition called athlete's heart, which we see in professional people or professional athletes, because they are doing it for hours and hours in a day. So there, when you see hearts, so you will see on 2D echo, you will see slightly bigger hearts, okay, and slightly dilatation of the cardiac chambers. You will see a slower heart rate of 40s or 50s, and you will, if you do the MRI in these patients, you will see slight amount of scarring in the heart. and which can in the long term cause slightly heartbeat problems. Slight
So,
heartbeat.
so doc, see, this is all like, when we go for testing and understand, we're going very deep into the subject because I know you're very passionate about the heart. I'm just saying general population as runners, we don't have access. I mean, not access, but we're not doing all these things. So how can I take care of my heart health while I am running? What are the main things that I can do? And what are the things I should avoid? I think all of us here want to understand that. How can I implement this in my life? And
As I
probably
said, see,
yes, go ahead.
as I said, the if you go from deep study of athletes' heart, there are a lot of things, but we don't have to get scared of that. Okay, most of us don't overdo things. Most of them realize that we are responsible, that beyond a certain limit we know that this is going to be harmful, especially if you are a runner who is running for say 7 8 years. By the time you realize that we know how much is our capacity, how much is going to damage us, and we know our limits, so we try to cut down. So I would recommend that every run you see to it that the runner community is very much aware of this 80-20 formula, right? So 80-20 is where you do 80% of your with a slow pace, which is excellent, and 20% of your workouts at the fast pace, which is I
Hmm.
think one of the best formulas which all runners should apply.
Hmm.
And you restrict your races to little, say 1 or 2 in a year, especially the long ones, the marathons, the 42-kilometer ones. I think 9-10 kilometers, half kilometer is still okay, but the 42 kilometers, I think at least 2 in a year should be good enough, because beyond that it's not going to help any benefit except for the timing or a personal best which you will achieve. Right? And at the same time, see to it that your, as we earlier discussed, blood pressure, cholesterol, and the sugars, whether they are in range. So if these three are in range and you are eating well and having a good sleep hygiene, I think you should not be worried at all. In fact, it's
Is
a
there
good thing that
anything
runners
else we
exercise.
can? So now that we are coming into, the post-COVID era and we are coming back into our fitness, we're slowly starting with our running, our journeys back again, outdoor activities. Is there anything else that we can personally do to, to train our bodies post this COVID scenario? Because I think we went through, like
Correct,
we
correct.
all know we were scarred in some ways during COVID. So how can we be better in this post-COVID
Yes,
scenario?
a lot of people had totally stopped their exercise because of COVID restrictions. So I think if, as rightly said by most of the coaches, if you are going to start it again, then it is better to go slow and go for gradually build it up. The incremental, say around 10 to 20% of your volume or your time which you run. So slowly every week you can build it up gradually. Like, so you need not go directly to a half marathon because you are running it pre-COVID.
Hmm.
Especially in elderly, what we have observed is who have had COVID infection, their lung capacity is slightly less, so they are not able to keep pace what they were pre-COVID, so their paces have reduced, and they do feel there's something called as a chronic fatigue syndrome. So there are a lot of people who say that we feel fatigued when we walk, we feel tired all the time. So there is a slightly higher prevalence of this condition. Now we don't know for sure whether this is all because of COVID or it is because of some mental stress or chronic stress, loss of job, or loss of income, and family death of a family individual. So there may be a lot of factors affecting. But if we are going to restart the exercise, it's always better to go slow and steady and then gradually build it up. Right? So, and if you have had a very severe bad infection during the COVID, then naturally the lung capacity is going to be less. So in those cases, normally there is a rehabilitation program by most of the hospitals where you are observed doing exercise and then gradually you build it up. So that is, but I think for a normal lay public, slow, steady, and gradually build it up, because I think most of us we will return to your normal pre-COVID, you know, say situation or
So
whatever you
I
have.
think everybody here, because of the things that we have seen after post-COVID scenarios, where increasingly it started that, if you overdo it, you could probably get a heart attack, or marathoners are getting heart attacks. So fitness and health became a big issue. Also, there was a big boom in, taking care of one's health. What would you say are your top, say, 3 or 4 take-home messages to everybody who's listening?
No, I think the recommendation from the AHA, aerobic exercise, 2.5 to 5 hours a week, and you can go up to 9 hours of exercise in a week. I think that is good enough. So that is something which is extremely good. But these are moderate exercise, okay, moderate
Right.
intensity. And vigorous intensity, I think we need to cut it down a little, so that if somebody is a very professional athlete running for years and years, it is still okay, because some people are addicted to running
Right.
long marathons, Ironmans and all. Like, I think there, I think they can still continue. So in
Again,
the,
I
if you
think that comes from how one is training themselves. No one really jumps into an Ironman. There's so much
yeah,
of training
so if
that's
you
going behind it. So they have a very fixed pattern into how they're training.
so if you are trained well, I think there is no issue at all. So if you ask me from a doctor's point of view, professional athletes who have been running for 30, 35 years, and after age of 60, they have slightly higher chance of heartbeat problems called AF, where the heartbeat becomes irregular. So if you ask from a doctor's point of view, there is a slight increase in the prevalence of AF. That is what we normally see. But again, medical condition which is not very risky, we can control it. But then the benefits of exercise are so enormous that I would not want to dissuade a person who is already exercising, doing well without any issues. So I would not want to unnecessarily say scare him and say don't do this, don't do that. As long as you are comfortable, as long as you are having a good time, and as long as you have a good sleep hygiene, you're not overdoing stuff, I think it should be totally safe.
What would your two main things be that do not do this, avoid these two important things? What would that be?
So do not make every run a fast run. So every run
Okay.
is not for a personal best. Have some runs just for enjoying that run, because running is what finally something which you should enjoy. So
Right.
that is number one, and take care of the other factors also, especially sleep deprivation, because
Hmm.
we all runners, we get up early in the morning, 5 o'clock, 6 o'clock, and everybody is busy with their work. So during the daytime, we don't get a lot of sleep. We come home tired, and then again, अरे अपना race है, we have to practice for that. आज का training program 6 बजे उठ के जाना है. So you see, we are deprived of sleep, and sleep is extremely important when it comes to health, because that is when the body is resting, recuperating, and building up the because finally, what is exercise? Exercise is something which are putting stress on the body. So
Yeah.
then when you use the stress, there should be some rest. So after stress has to be some rest. So rest is during sleep. So sleep is the time when the body is actually healing, and you will be a better athlete if you have a good rest interval in between, good sleep in between. So I think adequate rest in between your training intervals is extremely important.
So I understand that you take care of your essential aids, you know your numbers at least once
Yes.
a year, you check your blood report, so you know you are in the track. What you're doing is the right thing, though you feel healthy. And
Right.
what a nice message is, don't make every run, a fast run. Don't make it a personal best every time. Do something just for the fun of running, and always take care of the ancillary things along with your running. So these probably are our main concerns that we want to look into when we get into this fitness journey.
Right.
Correct me if I'm wrong. That's where
Yeah.
we headed into.
I totally agree.
Absolutely. It was really nice understanding so many things. We went so deep into certain aspects about, it might
Right.
have scared a few of us to know how much of it is going on within the body. What we see outside is not always what meets the eyes. So I'm
No,
keeping the session open for questions. If you have any questions, if anyone wants to ask Doc anything, so we'll have a couple of questions to know something deeper, or maybe some of your own reports that you want to share, because we had somebody telling us that their HDL was higher than what should have been. Okay, so let's see. Ramachandran, we have this question. Hi. Should people who have been sedentary all their life start exercising suddenly? Is there a danger to that, and how much should they start with?
first of all, a very good evening to Ramchandran. So once, if there is a sedentary fellow who has not been exercising at all, then I would suggest that they should at least have a health consult and do a test called stress test. So stress test is where we make the individual walk on a treadmill and
Right.
see whether their ECGs are okay or whether their cardiac fitness is okay. So As long as if you're doing walking, I think there should not be any problem. If a sedentary individual starts walking, which is a slow walking and then gradually builds up with a brisk walking and a slow jog, I think there is no problem at all. But if you are going to run, then naturally a sedentary person directly going into running would be little risky. So there I would
Right.
suggest that, and if you have a cardiac history, especially diabetes in your family, or you have a diabetes, you have blood pressure, you are elderly more than 60 years, then definitely you should undergo a stress test, see whether your cardiac fitness is okay, and gradually, as per the test, then the recommendation is there. You can do those because we calculate what is called a METs, which is a exercise equivalent of the test, and then accordingly we recommend doing the
So
exercise.
safe side, start walking and then slowly build up.
I think brisk walking is the safest exercise, which every individual can do. In fact, all of
Right.
the individuals who have not been exercising at all, even
Right.
they can do. In fact, I see a lot of cardiologists giving the wrong advice because when the patient suffers a heart problem, they say, "Arey, ghar se bahar mat niklo. Whole day you have to sit at home, take complete bed rest. It is very risky," and they scare the patient. In fact, I think it is wrong on their part to give such advice. Lot of times, patients can exercise even if you have a heart problem. A slow walking, brisk walking gives you a lot of benefits, and there they
Great.
should definitely do it.
So we have the next question, that is, during the events, most of the sports drinks offered are full of sugars. How to circumvent around this?
Yeah, so there are commercial drinks which are available, which are little higher concentration of sugar. But if you are running like a marathon or if you're running something which is in hot, humid weather where you need some energy, I think there is no problem because you're going to burn it out. So there's not an issue at all. But if you want a simple drink, there you can just prepare something like a ORS, where you just add some 1 spoon of sugar and 1 pinch of salt in a glass of water, which is a homemade solution, which can also be good. So if you're exercising, which is something which is vigorous exercise, I think sugar is good because it will give you energy to exercise. It is going to improve your form because carbohydrates, finally, for exercise, you need carbohydrates to burn it out.
Yeah.
So for the brain, you need sugar, but don't go overboard by drinking too much. So there are a lot of nutritionists and coaches have given recommendation that per kilometer, how much should be the intake of fluid, depending
Yeah.
on your sweating, depending on your urine output. So I think if you follow that, I think even if they are sugar, it is okay because they are not too sweet. Even if means even I use some of these drinks, but then it's not too sweet. It's not. It has some amount of sugar which will give you capacity to exercise. So I don't think there is an issue there.
Okay. Okay. Do we have any other questions coming in? Kranti. Okay. Hi, Kranti. Um, yeah. So I just brought this up. A recent lipid profile of a regular runner had higher HDL, higher than the normal range. Though it's good cholesterol, it's beyond the range. What precautions can be taken in such a case?
In fact, not much of precautions because it's a good cholesterol. So good cholesterol is supposed to be beneficial for the heart. So till now, the data has always shown that patients with high HDL are protected. Okay, so that's why there is no need to take any precaution. If your LDL is high, which is a bad cholesterol, so you have a high HDL along with the high LDL, then definitely we need to treat that, the LDL. Okay. Now there is off late in the last 1 year, there have been some reports saying that the HDL cholesterol may be harmful in some
Hmm.
individuals. High HDL cholesterol off late, maybe last 1 2 years only this data has come up saying that HDL patients had slightly higher risk. Now it is too early data, so still difficult to make a conclusion on that. Whether you can treat or you need to treat. But therapy wise also, we don't have therapy which reduces HDL. We have therapies and medications which can reduce LDL, but yet we don't have therapies which can reduce your HDL.
So we basically don't know why the HDL has gone beyond the range.
So
There's no
most of
particular
these,
reason.
yeah, so most of these are genetically, in your family, if you have a high HDL, you will have a high HDL. So these
Okay.
cholesterol values, most of them thing are genetically, say, phenotype. So of a genetic
Hmm.
phenotype. So whatever your genes say, that will be your HDL.
Hmm.
There's some issues like a lipoprotein A, HDL. So these are like, we cannot change them by diet or exercise. So they are genetically formed. But no
There's
need to
another
worry.
nice
As I said,
question. Sorry, there's another nice question that's come up. Excessive sweating while working out. Can this be normal for some athletes, or is it anywhere connected to a heart issue?
excessive sweating totally normal in a lot of athletes. So if it's hot, humid weather, I think there's nothing to worry about, because excessive sweating is the way by which your body regulates your body temperature. So that's a good thing. But if you start feeling giddy, so a lot of people, they during exercise they are sweating a lot and they start feeling giddy, and sometimes in some cases they may fall or they may have a blackout. So there, if you are having a blackout during exercise, again it may be because of low blood pressure. But then there we would definitely investigate, to know whether there's a heart-related issue, because some heart-related issues like coronary artery blockages can cause giddy feeling, because the giddy feeling also sometimes can be associated with excessive sweating. So the patients will say that, I had excessive sweating and I was feeling uneasy, and after some time I started feeling giddy, and then I fell unconscious. So if it is there because of coronary artery problem, then we would investigate. There is also a condition called vasovagal. This is a very common condition where, because you are an athlete, your blood pressure remains to be on the lower side, heart rate remains to be on the lower side. So when you
Right.
sweat a lot, because of excessive sweating, you are a little dehydrated. If you're not having adequate water intake, salt intake, then naturally your BP is going to go down further. And then you may feel giddy, sweat, and then faint. Now that's a
What
normal
about
condition.
what about people who always have like low BP? So I know a lot of people. I'm one of them. So I generally range at a lower side on my BP, and I'm
Right,
absolutely fine. I don't have any issues. I'm always
right,
told, or such people are always told, no, this is normal to your body. But do you
right.
see it leading to any issues, or it's just
In
how the
fact,
body is?
that's the normal thing in ladies. So if you see ladies, especially pre-menopausal, they
Hmm.
always have low blood pressure.
Okay.
So most of the coronary risk factors, that is blood pressure, sugar, or diabetes, or cholesterol, even the blood pressure going high, they all develop after menopause. So it is basically because of the estrogen that the blood pressure is on the lower side. And if one is an athlete, then that is going to be lower. So in fact, if you see a lot of ladies, you check the blood pressure compared to a male, they will have low blood pressure. Their BPs will be 90 or 100 systolic, which is definitely low. But of course, that makes them little prone for giddiness. So when you
Hmm.
suddenly stand, when you're bending down, suddenly you feel little blackout, or when you're
Correct.
doing some exercise and you're sweating a lot, you feel as if you may faint. So there, the treatment is only increase the salt intake and water intake, because you just need to be adequately hydrated by this. So that should be, but it's a totally benign thing. Need not be worried about causing any long-term issues.
Hi, Manor. So Manor's question is, in my run, no, if a runner gets a sudden heart arrest or an attack,
Yeah,
what should be my first course of action so I can help him?
I think CPR, because as I
Yeah,
said,
like
when
you
the cardiac,
mentioned.
yeah, when the heart arrests, there is only the bystander CPR, because it's only bystander who is standing next to him, who is really next to the patient. So immediate start of CPR, that is called cardiopulmonary resuscitation, is the only thing which will revive the circulation till medical help arrives. The medical help is in
Yeah,
normally in the form of the AED, where the device which we give shocks. So
yeah,
all marathon events normally should have a AED, which is there. So with somebody who is on a bike, so that you can reach that
correct.
space in 1-2 minutes. But the closest is the CPR, which a bystander should give. So every individual, not only runners, every individual, every family member should know CPR. And in fact, earlier we didn't have any good training courses, but now there is one Save Heart Foundation or
Hmm.
Revive Heart Foundation, which is a sub body from the Holy Family Hospital. They have regular CPR courses for institutes, for corporates, for individuals, and it is excellent. Excellent, because it's hardly 1 day course where you learn CPR, and that is the thing which will save the patient. Because you give adequate CPR for maybe till the medical help arrives, the patient will be okay. So, just giving a cardiac massage or
Correct.
learning CPR would help.
There's just maybe one last, okay. I just wanted to ask you one small thing. Is there any major difference between women and men health and fitness? Because we understand that cardiac related issues might be different for, like you constantly talking about menopause, pre-menopause and post-menopause. Is there something, maybe one takeaway for women and men differently, where the exercise plays a different role on their heart health?
In fact, the benefit of exercise is more in females. Yeah, because their bodically, physiologically, their bodies are different. So the blood pressure reduction, the heart rate slowing is much, much better in females compared to males. So in fact, if a lady exercises even half an hour a day, it will be equivalent to a man exercising, say, 45 minutes a day. So the amount of exercise of males, so the benefit is much better than the actual amount of time required. So exercise as a form of maintaining health, excellent option. But when it comes to symptoms, for example, heart attack. If you have a heart attack, males will always complain of chest pain. But the females may not have the typical symptom of chest pain. They may feel uneasy, they may feel fatigue, they may feel gastric acidity. So there is masking of the typical symptoms in females. So sometimes, especially, and this is proven world over, that lot of times females present with atypical symptoms. So if you have an atypical symptom, like, you're not feeling okay, you are feeling very uneasy, you are having some chest burning, some breathlessness, some nausea, some vomiting, best thing is to do an ECG so that it's not picked up. Maybe it's picked up easily. Other thing is that, as a general rule, females tend to say neglect their own health. नहीं ठीक हो जाएगा, कल जाएंगे.
Yeah,
because they are busy in their household work. Because normally you will see middle class, even lower middle class, all females, they're housewives, cooking for the family, taking care of the family, busy whole day. So when it comes to some chest pain, they say नहीं जाने दो, कल देखते हैं, परसों देखते हैं. So there is terrible neglect not only from the females but also from the family members, because they tend to say अच्छा कल जाएंगे, they tend to ignore it. Jabki actually you should be taking that family member, getting it treated. So there is a late presentation which we see in the hospitals when the patients are the females. The male will arrive within an hour if he is having chest pain. Within an hour or two, they will come to the hospital. But the females normally arrive, after 1-2 days. So I think that should not happen.
This is very, very informative. I mean, to understand the difference, because this is where we might neglect, like you said, it's not radiating to my arm, it's not in my chest, so I might neglect it. And now you bring a different perspective. So that was really nice. I think we have one last question before we close the session. The 25 to 30 kilometer mileage, which you were suggesting per week, someone's asking, should it be at the marathon pace or should it be at a slow pace?
I think not at a marathon pace. So, because if you are running only 30 kilometers and you're doing everything at a marathon pace, it's not going to be effective. It's still going to be marathon. It may not give you a lot of benefits, because, as I said, if you're doing more than 9 hours of exercise a day, the benefit becomes less, because then you're not going to gain anything extra. Right? So you're not going to harm yourself, but you're not gaining anything by doing extra. Right? So there I would say that you can divide it into, maybe 60-70% of slow pace or 30-40% of fast paced. So normally these coaches advise, and there is book by Run Less, Run Faster. There's a book where they advocate, 3 days, 1 day of speed interval, 1 day of tempo, and the third run of long run. And that is what normally the running coaches, if I observe them, I see that they are divided into these three
forms.
That's
the kind of pattern.
Yeah, speed runs, tempo runs,
and there is some amount of strength and resistance training involved. Yes, so so I think the perfect take-home message for us is to balance it out, and not only focus on our exercise but also on ancillary things which is supporting our health of the heart, to keep our numbers in check, to sleep well, to eat better, to hydrate well, to also see if our family members have any history and whether that's kind of affecting us, to know that women and men present differently to the same kind of problem. So this has been very, very informative, Doc. I'm so happy that we could share this session, and I hope all our viewers got some really nice information out of this. Even if it's one take-home message, it makes a big difference, because our community, it's word of mouth. One knows, one always goes and tells the other. So thank you so much for being with us, for sharing your time, your knowledge, the information that we've had. It's been a blessing.
Thank you. Thank you for having me.
Thank you so much. I hope everyone has enjoyed the session, and if there are more questions, you know, the runner community is always open to answering, to helping each other. Thank you so much for joining in.
Bye-bye.
Bye.